Hi everyone, this is Mike Brazel with Our Benefit Solution. I'm going to come to you today and talk a little bit about preventative care. And under the Affordable Care Act, you and your family may be eligible for some important preventative service which can help you avoid illness and improve your health. And it's at no cost to you, so no copays, not subject to deductible or anything like that. A list of a few of the items, when your normal checkup for the ladies' mammograms, pap smears for guys, as you get in your 50s, prostate exams, blood pressure, diabetes, cholesterol tests, many cancer screenings, alcohol or tobacco kind of counseling, all the childhood immunizations, child welfare visits, lady welfare visits, a whole list of things. And a great place to go for that kind of a resource to find out about it is if you'll go to healthcare.gov and type in preventative care. It'll bring up a list of covered preventative care services under the Affordable Care Act. So, and you can go scroll through here. You'll see, there's quite a few: alcohol misuse screening and counseling, some specific testing for people that used to smoke, aspirin for heart conditions, screening for blood pressure, cholesterol, colorectal, depression, diabetes, diet, HIV screening, and immunizations, a certain list of that, obesity, STDs, things like that. And you'll see there's a list for the ladies as well. Specific tests: anemia, bacteria, BRCA, breast cancer, mammographies, breastfeeding, cancer. The list goes on, and even down into the childhood. So, I encourage you to go look, because that list does change from time to time. The one thing I would tell you about preventative care, it all bases on what the doctor codes the bill. So let's say you go in for your yearly checkup and they call it a preventative care visit. You're going to go. There's going to be no copay. There's going to be no deductible. You're literally going to walk in and out, get all your blood work and everything done and paid for. But let's say in the course of that screening, the doctor sees that your blood pressure is up, or better or worse than that, you've actually had some blood pressure stuff going on, and during that visit he goes ahead and he treats you for the blood pressure as well. Well, the problem you're going to run into is that's now a diagnostic visit. So I encourage you, when you're meeting with your primary care physician and you're doing these preventative care tests, make sure that you're mentioning, if you could help me out by making sure this gets coded in the billing as preventative care, because once that bill goes off to the carrier, you're going to have a hard time getting that changed. If you have any additional questions about healthcare reform and preventative care, obviously one of the resources I just mentioned was healthcare.gov, but you can always contact your benefit advisor or us here at Our Benefit Solution at 888-812-6619. Thanks, and have a great day. Bye-bye.